Okay, we're back, and this one final slide on vitamin D I wanted to touch on. And you also see the references for all this information down at the bottom. But studies have shown that obese adolescents are at a greater risk for vitamin D deficiency because vitamin D is thought to be sequestered by excess adipose tissue. So because vitamin D is fat soluble, it tends to get stored in fat tissue, and so now less of it is available to circulate through the bloodstream. In turn, poor vitamin D status is associated with a higher prevalence of metabolic syndrome, type 2 diabetes, or both in adults and in adolescents. So as younger people now are becoming more and more overweight, their vitamin D nutritional status seems to be less. A lot of that vitamin D being sequestered in their adipose tissue cells. Now, in a study by Balanche and followers, the efficacy and safety of 4,000 IUs of vitamin D per day was administered to a group of obese diabetic adolescents. So this was a group of overweight adolescents. Their average body mass index was almost 40. Compared to the control group, the vitamin D supplemented group showed significant increase in serum 25-hydroxy vitamin D levels, fasting insulin, and improved insulin sensitivity. So that 4,000 IUs a day, without any other lifestyle change, started to improve some of these parameters around glucose and insulin sensitivity. The researchers concluded that the correction of suboptimal vitamin D status through dietary supplementation may be an effective addition to the standard treatment of obesity and its associated insulin resistance. A 2010 study showed that women who took a vitamin D supplement of 400 IUs per day had an associated 24% reduction in breast cancer. So this is a bit off topic, but I thought I would include it. In this observational study, breast cancer cases aged 25 to 74 years old, diagnosed between 2002 and 2003, were identified through the Ontario Cancer Registry. The controls were identified by using random digital dialing. In total of 3,101 cases and 3,471 controls who didn't have breast cancer, they completed the epidemiological and food frequency questionnaires. The study suggested that vitamin D from supplements, not from food, was independently associated with a reduction in risk of breast cancer. So just that 400 IUs a day people get from just a typical multiple vitamin may actually be helping to reduce risk of certain cancers, as illustrated by this 2010 study. So this is sort of the vitamin D story in all its glory that we have so far, and I think that in the years to come we're going to see a greater amount of evidence suggesting that in people who are overweight, people with metabolic syndrome, people with type 1 and type 2 diabetes, that knowing their blood level of vitamin D is critical, because it affects so many parameters of the disease and the risk factor profile, and that getting their vitamin D into the more ideal range, at least above 80 nanomoles per liter, and I'd like to see even up to 150 nanomoles per liter personally, but at least up to 120, that it's affecting insulin secretion, insulin sensitivity, regulating the immune system, helping to reduce inflammatory states, and helping to spare some of the damage to the beta cells in the islets of Langerhans, a very important immunoregulatory consideration. So we've looked at a lot of different nutrients now and supplements. So how do you put the story together for the diabetic patient? So here's an overview of supplement considerations in diabetic patients. This is sort of an aggressive plan of action. Not every diabetic patient is going to need all of this. Not every diabetic patient is going to be willing to comply with this. But this is what the conversation that I want to have with a lot of diabetic patients that I see. I like to put them, unless they have failing kidney performance, a decline in renal function that's significant, or liver damage, then I like to put them on a high-potency multiple vitamin and mineral that delivers 1,000 milligrams of vitamin C a day in divided doses, 400 IUs of vitamin E, which may also help to reduce Alzheimer's disease because they're prone to type 3 diabetes, which is a form of Alzheimer's in their diabetic patient. beta carotene at 15,000 IUs, selenium at 200 micrograms, the full B50 complex to also keep homocysteine levels down. The 15 milligrams of zinc, important for eye health and immune system competence, and just everything from vitamin E to zinc in reasonable amounts. But I like this antioxidant-enriched B50 complex, and with also 1,000, you don't see it here, 1,000 IUs of vitamin D and 500 milligrams of elemental calcium, all built into one multiple vitamin. So the person would take 2 caplets twice a day to get that full adult dose. So this really is the multiple vitamin. I formulated this particular one for Adeva Nutritionals, and I think it has application here. And then there's this combination that I talked about earlier of chromium, hydroxycitric acid, and catechins from decaffeinated green tea. And so once again, these are the doses that I like to use. This is a product that I also formulated called Body Burn under the Adeva label. But you can find these nutrients in other formulations as well. But chromium at 200 micrograms a day, hydroxycitric acid 1,000 milligrams a day, and the green tea catechins 600 milligrams a day. So to get that total dosage, a person would take one of these capsules 3 times a day to get that total dosage that you're seeing there. Sometimes I will actually double the dose in the first couple of weeks, where I'll give them 6 capsules a day, 2 capsules 3 times a day at meals, to get that extra chromium and that extra hydroxycitric acid and really kickstart their brown fat. So remember that the chromium is increasing insulin sensitivity. The hydroxycitric acid is helping to block the conversion of carbohydrates into fat and acting as a natural appetite suppressant. And the catechins are upregulating brown fat, making the person more thermogenic, and we think also increasing insulin sensitivity. And then, of course, essential fatty acids, whether it's just straight fish oil or a combination of flaxseed, fish oil, and borage seed oil, to maximize prostaglandin 1 and prostaglandin series 3 synthesis, to decrease platelet stickiness, increase circulation, decrease inflammation in the blood vessel wall and elsewhere, including the insulin receptors, helping to lower triglycerides possibly. If there's already neuropathy underway, the borage seed oil we think can be helpful in the treatment of that neuropathy. That's why this combination I find quite appealing. But the idea is to give them 3 capsules a day of a total capsule that would, in one capsule, be 1,200 milligrams of essential fatty acid material, and giving them 3 capsules a day is usually what I shoot for in my protocol of essential fatty acids for these individuals. And then if they happen to have cholesterol that's elevated and or triglycerides that are elevated, and it really varies from one diabetic patient to the next and one pre-diabetic patient to the next. These cholesterol and triglyceride levels can be all over the place. Sometimes they're actually quite normal and just the glucose is high and the glycosylated hemoglobin is high. But where you have high cholesterol and triglycerides, if diet and exercise alone doesn't bring it down, and with the help of ground flaxseed and or psyllium husk fiber and oat bran and eating more beans and peas and artichokes, if that doesn't bring it down, then I would be inclined to use sort of a combination of gum google and artichoke leaf extract. This is also a product that I formulated for Adeva called Coliforte, that has the amount of google sterones and artichoke leaf extract that's been shown to lower cholesterol and triglycerides. And you may even get a bit of a glucose lowering effect from the artichoke, as we've seen in some experimental studies. But in order to make this product work, you have to take 2 capsules 3 times a day. So it's a lot of capsules to be swallowing. And then there's the consideration of some additional quercetin. If I include it, I usually keep the dose around 100 to 200 milligrams twice a day with meals. If there's cataract development or a lot of inflammation, I might include quercetin. It's not always my go-to supplement. And then if you want to raise glutathione levels and provide some of the nutrients that have been shown to help slow down the decline in kidney function, then I might put them on a combination supplement like that has N-acetylcysteine, alpha-lipoic acid, L-glutamine, and the standardized grade of milk thistle at 80% silymarin content. The idea here is that the alpha-lipoic acid and N-acetylcysteine have been shown to reverse kidney damage and improve function in some preliminary human trials. Now, if they have fairly advanced decline in kidney function, if the kidney disease is fairly advanced and they have let's say a glomerular filtration rate that's below 30, it makes me very nervous to give any kind of supplements, even ones that might actually help to improve kidney function. From one person to the next, it might just add more stress to the kidney, and it might actually make things worse. So kidney function has to be monitored very carefully if you're going to even include a supplement like this that's designed to actually help kidney function. But it doesn't mean that it might not also make it worse in some cases. Remember that silymarin and L-glutamine also help to raise glutathione levels, which can protect the kidney function and liver cells as well from free radical damage that you see in diabetes. So if the kidney function is still above 30 and preferentially above 40, then I feel a lot more comfortable giving a supplement like this and hoping to see that the EGFR improves and the creatinine level is actually coming down. And I have seen this. So that's why I would put this slide here. But if you're going to administer this or recommend it, then make sure kidney function can be monitored very carefully. And if you see any kind of further decline in kidney function, you have to get them off this immediately. And then there's this consideration of this supplement called bitter melon. I haven't used it personally. I think there are practitioners out there that have had good success with it, but this is the dosage and standardized grade that you would consider if you're going to use bitter melon. And of course, these are the other dietary and lifestyle considerations in diabetes. You want to give them a diet that's going to also deal with the cardiovascular risk factors, to get the saturated fat out and the trans fats out and the total amount of cholesterol. You want to keep that low, and the inflammatory foods low. You want lower glycemic foods to keep the glucose down and to decrease the advanced glycolylated end products like fructosamine and hemoglobin A1C, and more soluble dietary fiber to slow down the absorption of glucose into the bloodstream, and that also helps to reduce cholesterol levels. And you want the aerobic exercise to increase insulin sensitivity, get their body fat down, and improve how their body's using glucose and protein as well, and get their waist circumference down into what's considered to be a safe range. For men, under 36 inches. For women, under 34 or 33 inches. That's the target you're generally going for. And of course, on the supplement end, if I just go back a slide, you'd also make sure you'd look at that vitamin D level and make sure the vitamin D level is in the optimal range, above 80 nanomoles per liter, up to 150 nanomoles per liter, but certainly moving it from 80 up to 120 nanomoles per liter in the diabetic seems to be extremely helpful. So I think we'll leave it there. When we come back, I'm going to give you my final thoughts on how you talk to the diabetic patient about making dietary changes. They've already been given nutritional recommendations and pamphlets and meal plan designs, usually by a dietitian, by their family doctor, or by a diabetic specialist. So they already have that knowledge coming in. Often they're not even complying with those principles as well as they should be. And now they're coming to you looking for some further help. Certainly on the exercise side, considering certain supplements, if that seems to be a safe thing to proceed with. You have some ideas here. And what I'm going to give you next is the things that I emphasize in terms of the dietary regimen that I try to hold the patient accountable to in the most serious way that I can. So we'll look at that when we come back after the break.